Good morning, I'm Maiki Oreta, and welcome to Industry Beacon, where we shine a light on the trailblazers, the disruptors, and the industry leaders shaping our future. And in each episode, we'll explore how they're staying ahead in their respective fields, one industry at a time. Now, joining us today is Paolo Borromeo, the president and CEO of Ayala Healthcare Holdings, or AC Health, a company leading the charge in revolutionizing medical services in the Philippines. Under his leadership, AC Health has launched groundbreaking initiatives to improve access to care, including expanding digital services and building specialized facilities like the Healthway Cancer Care Hospital. With a clear vision and a deep understanding of the industry, Paolo will share his thoughts on the biggest challenges, emerging opportunities, and the innovations shaping the future of medical care in the country. Paolo, welcome.
Hi, Mikey. Good morning.
Good morning. Okay, so the Philippines is known for having, some of the best healthcare providers in the world. But when it comes to infrastructure locally and financing and growth in our own home court, there are some unique challenges. Can you tell us, give us the lay of the land? What is this industry like right now in 2024?
Yeah, well, I look at the healthcare industry as an investor and, of course, as a practitioner, although I'm not a doctor, Mikey. But we look at healthcare, it's one of the fastest growing sectors in the country. We compare it to other industries like oil and gas, consumer, retail, etc. And over the last 5 years, it's grown 10, 11%. And we're looking at growth of 9 to 10% over the next few years. Mm-hmm. If I'm not mistaken, we're second highest in Southeast Asia among countries in terms of healthcare expenditure growth, which is huge. Mm-hmm. So I think it's exciting. We've come a long way. Obviously, government has helped push the agenda forward. Healthcare is always top priority for governments, including this administration. Mm-hmm. We've passed many landmark bills, the Universal Healthcare Law, the Cancer Care Act. And so what it's created is it's stimulated healthcare spending and healthcare utilization. Mm-hmm. And then you add the pandemic, and clearly everyone...
That helped boost your growth.
Well, yes, because obviously it put healthcare in the spotlight. Mm-hmm. And more importantly, I think it gave the ordinary Filipinos more awareness, significantly more awareness and more responsibility about their healthcare. So now more than ever, I think Pinoys are more conscious about their families and their need for healthcare. Absolutely.
Okay, now growth of about 9 to 11% annually. Mm-hmm. What does that tell you about this industry?
I think it tells me that there's increasing utilization. Of course, there's inflation, but behind the inflation is increasing utilization. So what that means is people are getting themselves checked. People are going to the doctor, getting themselves diagnosed, getting themselves getting their blood checked, getting their x-rays, which is an important thing. So I think that tells me that people are more and more, families are becoming more and more responsible for taking care of their health.
They've become much more cognizant, especially in the wake of the pandemic. On two fronts, financing and infrastructure, where would you say we are?
Oh, great question. I think, to be honest, I think we're still way behind where we're supposed to be. And this is something that we tackle at the Private Sector Advisory Council for Health for President Marcos, which I chair. Mm-hmm. And we meet regularly, and in many of our meetings, if not all of our meetings, the first thing we talk about is the lack of resources. I call that health human resources.
Okay, it's the people.
People. We're needing nurses, we're needing doctors, we're needing pharmacists, we're needing allied professionals. One of our first agenda items with the president was to tackle the nursing issue, which was massive, especially coming out of the pandemic. Countries were recruiting thousands and thousands of our nurses. Yeah. And so what happens is we're left here with quite a bit of a shortage. And so together with the government and with CHED and DOH, we created different initiatives to try to improve the pipeline of nurses coming into the system.
And how do you incentivize them to stay?
Well, I think it's a difficult thing. You can never compete salary-wise.
Yeah.
When the US, Singapore, Japan, they're offering 4, 5, 6 times what we can offer. Mm-hmm. We've tried to bump up the compensation locally, both public and private. But at the end of the day, hindi mo kaya eh. Yeah. So you compete on other levels. You compete by creating an environment that hopefully is conducive for them to stay, benefits that make it nice for them to stay. But otherwise, it's hard to compete on a daily basis. So I tell the president that. We also say that kulang tayo sa, I mean, we still lack facilities. So in terms of number of beds, we're quite short. If I remember correctly, I said we would need about 200,000 more beds. And if you think about it as 100-bed hospitals, that means 2,000 hospitals that we would need.
Yeah.
The gap is very, varies greatly depending on the geography. Metro Manila is better off because we have quite a bunch of hospitals here, right?
Yeah, the concentration of the best medical care
Cebu is okay,
yeah.
Davao is a little bit okay, but if you go, as you go to the more far-flung places, dyan medyo tayo nahihirapan. And so we need to build more capacity in those areas, what we call geographically isolated areas. And in many cases, it has to be a public-private partnership because private cannot do it, public cannot do it alone. And so where there are opportunities to work together.
Yeah. Speaking of geographic areas, in terms of the top illnesses here in the country for Filipinos, some of the top ones that you mentioned earlier when we were talking before the cameras were rolling were HIV and cancer. And you said that cancer is, it's a different kind of cancer depending on the geographic location. You're saying that in Australia, it's skin cancer. But here, it is breast and lung. Tell us more about what you're learning out at the forefront.
Well, I'm so thrilled. We just opened the country's first cancer-only hospital in Arca South, in Taguig. It's 100 beds, and it's state-of-the-art equipment. We've partnered with different leading manufacturers, pharmaceutical companies. It's world-class. We've partnered with the National Cancer Center of Singapore, with City of Hope in the US. But our goal is to try to keep the costs as manageable as possible. No?
That is the challenge.
But cancer, because cancer is a big problem, Maiki. In the Philippines, we have 180,000 new cases per year. Right? And I anticipate that that's kulang. There's a lot more that we have not
even detected,
identified because people are not screening as often as they should or as early as they should. So those, unfortunately, the 180,000 cases that we do screen, many of them are late stage. Many of them are very complicated. And because many of our fellow Filipinos cannot either access or cannot afford, a lot of them choose not to get treated anymore. No?
How important is the screening, and what would basic screening set you back by at your cancer care hospital?
Well, screening is very important. You know, we encourage early screening for everyone of all ages. We have different protocols, but for instance, if you're male, 45 years old, we encourage you to get checked for colorectal cancer. If you have a family history, for instance, of breast or lung, we encourage screening as well. You know, we've partnered with some innovative technologies, Maiki. So for instance, for lung cancer screening, low-dose chest CT scan is upwards of 10 grand, right? Which is probably one of the more affordable rates in the country. But still, it's fairly prohibitive, right? $200 for a fellow
especially
Filipinos.
for minimum wage earners.
But what we can do is we now do chest x-rays, and we're piloting this nice AI tool called Cure AI, which helps diagnose or detect possible cases just with chest x-rays that we can then filter through and recommend for a CT scan.
What are the most exciting technological advances on this front that will, you know, make all these treatments more affordable? What are you most excited about?
I'm very excited about cancer. You know, I keep on saying, imagine the development in oncology compared to like 20 or 30 years ago. Just the pace of development is huge. You're talking about new treatment protocols, new therapies. The field of pathology with next generation sequencing, we're able to detect what kind of tumor specifically, what algorithm. You have new blood transfusion methodologies. So ang dami. And so that excites me because what we really want to do is well, first, of course, help cure cancer. But at the same time, take the stigma away. No, so if you do get diagnosed with cancer, it's not a death sentence. There are many new therapies, immunotherapy, chemotherapy. The field of radiation therapy is also quickly developing. So it's exciting. To me, the kayang labanan, right? We can fight cancer. And the important thing is that Number one, we detect early, we screen frequently, and more importantly, that we all work together because no one group can do it alone.
Yeah, and the next thing would be financing. And Paolo, you're also the chairman of the Private Sector Advisory Council, or PSAC, meaning you lead the government's healthcare team.
Yes.
What is being done to make financing for healthcare treatments more accessible?
Yes, well, in the Philippines, unfortunately, like many developing markets, a big part of healthcare expenditures is out of pocket. Galing sa sarili nating bulsa, no? And I've seen, ever since I started covering healthcare, I've seen that statistic decrease over time, which is a positive development. From over 50% of national health expenditures, it's now down to 43 or 44%. And I anticipate that going down over time even more. Now, why? Number one, because PhilHealth benefits have continued to expand. And we're very happy working with the national administration, with the DOH, and with PhilHealth, that this year and last year we expanded PhilHealth coverage significantly. In many cases, PhilHealth was able to improve it by 30%, reimbursement rates. In cancer specifically, they offer a Z benefit package for people with breast cancer. That used to be, Mikey, the reimbursement rate for that was 100,000 pesos. 100,000 pesos, which is way, way below what it should be. They implemented an increase to 1.4 million pesos.
Well, that's fantastic.
Right, so that's huge, right? So what that does is things like that, if PhilHealth is able to cover more, then eventually, hopefully, the common person will have to shell out less.
Yeah.
Diba? So PhilHealth increases more. Don't forget that there's also private insurance in the Philippines. And as you see more private insurance and private HMOs, they get more coverage, cover more people, more dependents, more employees, then unti-unti rin babagsak yung out-of-pocket spend. So I hope we get to a level of maybe high 30s, 30% out-of-pocket spend in the next few years. That will help.
And with the changes on the macroeconomic front, I mean, interest rates are coming down. We're in an easing cycle. How do you see that helping reduce
the burden?
The burden.
Well, more than the burden, I think, Mikey, all of our studies show, and even government studies, show that if you do any pulse check with consumers, healthcare rises to the top of each and every Filipino family. Promise. Number one, number two, right? What is your most pressing concern? What are you saving for? So I think that Filipinos are really becoming more and more responsible for taking care of their own selves. That includes saving up for health. Now, so people are investing in health insurance, in dreaded disease coverage, and other things of that nature, which I think is positive.
Okay, we're going to be taking a quick break. Industry Beacon will be right back. Please stay with us.
Magandang gabi, ako si Corina Sanchez Rojas.
Magandang gabi, ako po si Pinky Webb.
Simulan na natin ang agenda.
Nasa radyo na, mapapanood, mapapakinggan.
94.7 FM.
Nahaharap ngayon ang Estados Unidos sa isa na namang 4 na taong Trump presidency.
Death squad rin yan. Binawi niya yung sinabi niya.
Ing masalimuot ang buwan ng Oktubre para sa ilang bilyonaryo. Sa bawat issue may anggulo at ang balita may agenda.
Hello and welcome to Follow the Money. I'm Rain Musni. Join us as we explore the tools and insights you need to jumpstart your financial journey. The crypto market climbed over $800 billion. Tech giant Alibaba has announced plans to issue notes. Investors are anticipating a significant downward move for the cryptocurrency. Swift is adding a new chapter to her record-breaking year.
Follow the Money, 10:30 a.m.
Keep it here on BNC, the Bilyonaryo News Channel. Always on top.
Welcome back to Industry Beacon, where we're diving deep into the evolving landscape of medical services and innovations with Paolo Borromeo, the president and CEO of AC Health. So, Paolo, earlier you touched on our facilities and resources not being adequate at par. Now, just to kind of bring that into focus more, we're specifically not at par with the standards of the World Health Organization for emerging markets.
That's right.
What do we need to do to build capacities?
Well,
and where do we need to focus?
Well, two things. I call it both capacity and capability. Capacity is physical, hard infrastructure. We need more beds. We need more hospitals. And, I think it's on all of us, private sector practitioners, to build more capacity. and it's on the public sector too to build more capacity. I see the government building more and more hospitals. I'm also proud to say that we just, like you mentioned earlier, we built the country's first cancer hospital. And we continue to expand all of our other hospitals. We now have 6 hospitals within AC Health called the Healthway Medical Network. That includes our cancer hospital. That includes our partnership with Far Eastern University, Nicanor Reyes Medical Foundation, plus our 4 other hospitals around the Philippines. We continue to look for more hospitals to invest in and to expand. We have 16 clinics, multi-specialty clinics all over the country, Maiki, and that's very important because where you don't have a hospital, you can put a clinic.
Interesting.
Right, a multi-specialty clinic. So for instance, in El Nido, Palawan, where there is no hospital, no private hospital, and as you know, Ayala has our development there, we put in a multi-specialty clinic to help people with their basic primary care needs. That said, I think we continue to look for where we can invest in terms of hospitals and facilities because the country really needs it.
Absolutely.
We're also looking to participate in public-private partnerships. We just announced a PPP with, for instance, the city of Valenzuela, where we're going to be helping them run some facilities. We're also doing other PPP projects with other LGUs. We're looking at the Philippine General Hospital PPP. So you need a lot of, I guess, collaboration and partnership to build facilities because building facilities is not an easy thing. In terms of resources, we work with all the different leading medical universities, Maiki, to help create more supply. Both with my hat as private sector advisory chair for health, but also at AC Health, we need people. So I'm very thankful that we have a partnership with FEU. Mapua is part of the Ayala group, but we also have partnerships with Ateneo, with UP, with UE, with LaSalle. So I rounded out the whole UAAP and NCAA. But it's important. So we have scholarships, internship opportunities, research collaboration with different universities, and that's the only way to improve the health human resources.
And Paolo, you guys have only been doing this for 9 years, coming on 10. You founded this in 2015. You were one of the founders of AC Health. Where are you going to go from here? You said 6 hospitals. What more in 2025? And everything that you're doing is expensive. Any plans to go public?
Well, first of all, AC Health is a 100% subsidiary of Ayala Corporation, and I'm very grateful that we have a very supportive a board that really thinks very long-term, because you have to think long-term for healthcare. And our principals are extremely supportive. Ayala is deeply committed to health. And I think it's a sector that we believe can be one of our next growth pillars, and more importantly, because of the huge social impact that we're able to generate by helping millions of Filipinos. No? Our vision for AC Health, Maiki, is to be able to touch 1 out of every 5 Filipinos by 2030. That means, 25 million people? We currently, in our network of pharmacies, clinics, hospitals, we touch about 6 million people. So our vision is to be able to get to 25 million by 2030. How do we do that?
Yes, how are you
investing
gonna do
in
that
more
as well?
pharmacies and more pharmaceutical groups. We currently have IE Medica, MedEthics, and Generica. We just acquired a minority stake in St. Joseph Drugstore, which is a leading pharmacy chain in the north. We are looking to touch more people by building more clinics and investing in more hospitals. So hopefully you see us expand those 6 hospitals, 15 clinics, to more around the country where it's badly needed.
Okay, what are the trends that are shaping this industry, and what are the trends that are here to stay since the pandemic?
Quite a bit. I think, for instance, one big trend on the negative side is HIV, for instance. There are certain disease groups that we just need to
clamp down on.
Okay. Cancer is one of them, and we've done a lot of work in cancer. HIV is our next thing. We recently launched an initiative with USAID, to promote HIV screening, detection, and treatment.
Yeah, you said there are 50 new cases daily.
50 new cases a day. We have 140,000 cases of HIV. If if untreated or if we unmanaged, we might be seeing 360,000 cases by 2030, which will be a major problem. Our partnership with USAID also reflects what we can do as a group at AC Health, because we have pharmaceuticals and we have hospitals and clinics, right? So through our importation business, i.e. Medica, we're able to bring in very important test kits for HIV, funded by the US government, or subsidized by the US government. We're able to bring in important medication. And I learned about this just a few months ago, Mikey, but in HIV, there are different categories of medication. There's medication for when you are HIV positive. No?
Depending on the severity of your case.
Those are antiretrovirals. There's medication for when you have had exposure. They call that post-exposure prophylaxis. Those are available today in the country through government. We import it and then we work with government to dispense it. But nowadays, there is also what's called PrEP, P-R-E-P. It's pre-exposure prophylaxis. So in the event that you feel like you will have an exposure activity, that there is now medication to help protect you from HIV.
Two really quick questions because we're almost out of time. What is your fearless forecast for this industry, Paolo?
I think healthcare is in its golden age. I think the Philippines will be a source of the world's talent for healthcare, and I think we as a country should build on it, both locally and internationally. It's a growth sector. There's lots to be done. There's a lot in the system that's broken and that needs intervention, and we can all play a part in helping fix it and improve it and make it a next growth pillar for the country.
Okay, and if Santa could grant this industry one wish, fix one problem, what problem would you want that to be?
I think you mentioned it at the start. It's improving infrastructure, both in terms of physical infrastructure and people. If Santa could give me 2,000 new hospitals as a country, I mean, wouldn't we all love that? If Santa can give us 100,000 more nurses, 100,000 more doctors, I think, wow, imagine what we can do for our fellow Filipinos.
And what a gift that would be. So thank you, Paolo, for sharing your insights on this industry with us. But more importantly, thank you for driving change, innovation, and accessibility where we really need it.
Thank you for the kind words, Maiki.
Okay, and that's it for today's show. I'm Maiki Oreta. Catch the Bilyonaryo News Channel on Free TV Channel 31 and on cable via Cignal Channel 24. Thank you for watching the Bilyonaryo News Channel, always on top.